I'm curious. I am curious. Curious.
By nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. Would you ever imagine that by changing the way you walk, you can reduce your knee problems? Today, we're joined by Julie Kolesar, a research engineer at Stanford University's Human Performance Lab. Her recent study shows how subtle changes in how we move, something as simple as adjusting the angle of your foot, can reduce pain and even slow the progression of knee osteoarthritis. With over 20% of adults over 40 suffering from this condition, her work is opening the door to drug-free, non-surgical ways to help millions of people live more comfortably. Dr. Kolesar, welcome, and please introduce yourself.
I'm Julie Kolesar, and I'm a research engineer at Stanford University in the Human Performance Lab. I am really curious about understanding how we can use science and technology to do good and improve the lives of others. We think the human body is wonderfully complex, and I've always just really been intrigued about the factors that lead one person to becoming, for example, a world-class athlete, performing at the very peak of human performance, and what leads another person to experience serious injury or movement disorders that make everyday life and activities really difficult.
You had a really interesting study published in August that can affect many people's comfort on a daily basis.
Mhm.
And so I was wondering if first you can tell me about that discomfort and how much, the pain from osteoarthritis in the knee affects people on a daily basis or around the world even.
Yeah, absolutely. That's a great question. So, osteoarthritis is incredibly common. I think the recent statistic says that more than 20% of people over the age of 40 experience some form of painful osteoarthritis. And osteoarthritis, or OA, really just refers to the degradation or the breakdown of joint cushioning cartilage in a joint. And so the knee is the most common site for osteoarthritis, for symptomatic OA. And currently, there really aren't treatments for reversing the damage caused by OA. So a lot of patients really can only resort to symptom management with things like pain medication. Sometimes that's over the counter, like ibuprofen. Other times it could be, prescriptions or narcotic pain meds. Sometimes people will get injections in the knee joint with like a corticosteroid that can help with symptoms. But for someone who has really severe symptoms and severe knee OA, really joint replacement surgery is kind of the only option.
Yeah, so can you tell me about the study that you're working on related to osteoarthritis and what you were hoping to achieve?
Yeah, so in our study, what we wanted to do was recruit adults who had mild to moderate knee osteoarthritis. And what we did was we trained them to make subtle adjustments to the way they walk by having them change the angle of their foot as they walked by either slightly pointing in with their toes or slightly pointing out. And what we did in this study was we personalized each participant's gait modification to really maximize the amount of loading reduction that we would get through their knee. And so each person walks a little bit differently. And so in our lab space, we use motion capture technology to get really accurate measurements of how someone is moving and walking. And by doing that, we can see what type of gait modification is able to best reduce the forces in the painful part of their knee where they have osteoarthritis. And so gait retraining, that's really just referring to making changes to the way that someone walks. So that's what we mean when we say gait retraining.
Are the techniques that you were retraining people to change their gait, would they be effective or possibly helpful for someone who has severe pain?
Yeah, that's a great question. So I think these techniques and methods could still be helpful for people who have severe pain. In our study, it wasn't necessarily mild to moderate pain that we were targeting, but really mild to moderate disease progression. And so we had x-rays of all of our participants and had a radiologist actually grade how severe their OA was. And the reason we targeted mild to moderate is because we were really looking to slow progression of their OA and see if we could not just alleviate symptoms, but actually slow the degradation of their cartilage. And so for someone who has really severe OA, our techniques might be effective in helping reduce pain, but they're probably not going to slow the progression of the disease because they've kind of already reached like that endpoint. So that's why for this specific study, we targeted the earlier stages, but it could still be effective, certainly in pain reduction for any stage.
When someone gets the prognosis from a doctor of like bone on bone, does that mean severe?
But yeah, so there's kind of a spectrum when someone initially develops knee osteoarthritis. Sometimes it's just a little bit of thinning of their cartilage. Sometimes they have a little bit of swelling or inflammation. And then over time, as the cartilage thins more, they might develop bone on bone, and that's really severe. They might start to develop something called bone spurs, where because of the excessive forces and loading between the bones, it starts to make little spurs and little bumps in the bone, which can also lead to more pain.
How did you assess which gait was ideal for them?
What we did was measure something called their knee adduction moment. And basically, that's kind of a measure, it's a proxy for the joint, the loading in their knee joint. So, since we can't actually measure forces directly inside someone's knee while they're walking, looking at this biomechanical metric, which is essentially kind of a torque about the knee. And so, someone who has a really high value of that particular metric tends to have more force and loading going through the medial or the inside part of their knee joint. And that's a really common area for knee osteoarthritis. And that was kind of the focus of our study. And that knee adduction moment is also a good proxy for forces and loading in the knee joint. So for each participant, while they're walking, we're able to actually plot and see what that metric looks like for them. And then when we prescribe the different gait modifications to them, we can see how each of those then is affecting that value and that metric. So when we selected an optimal walking pattern for a participant, we were picking the one that reduced that value the most for them while they were walking.
And how did you measure that load on their knee as they were walking?
Yeah, so in addition to the reflective markers we have placed on our participant in our motion capture technology, that gives a really accurate measurement of how their body's moving and like joint angles. But the treadmill they were walking on was a special treadmill that had force plates underneath the belts. It was a split belt treadmill. So there was a force plate under each of the belts, which means we were able to calculate forces as they were walking under each of their feet. And so with that force information, as well as the movement and motion of their body, we're able to calculate those values.
There are other issues as well, like torn meniscus and things like that, that maybe are even going along with the osteoarthritis. Have you taken a look at that or have seen that if the gait retraining makes a difference for situations like that?
Yeah, that's a good question. We didn't specifically look at whether there were kind of concomitant like things going on, like with meniscus, for example. Um, we get MRIs of our participants at the beginning and end of the study, so we are able to see if someone has other soft tissue damage or things going on, like a meniscus tear. But it's not something that we specifically studied or kind of controlled for in this particular study. That being said, though, I think even if someone has some of those other soft tissue injuries or meniscal tears or things like that, I don't think there's any reason why this study and the technique we used here wouldn't still potentially be beneficial for them.
How does someone get the benefits of what you've studied? Do they need to come to your lab? Do they need to get that gait retraining with you, or how could they do it?
For this study, each of our participants came into our Stanford Human Performance Lab, which used, like I mentioned, motion capture technology, which is very expensive equipment. It involves putting reflective markers over someone's body and measuring with specialized cameras the way their body's moving. So there's a lot of technology and a lot of state of the art things that are going into that. Obviously, that is not something that you can really deploy at a large scale, and it's not necessarily accessible to a lot of people. And so currently, someone would have to come into our lab to get that gait retraining. However, our lab has since started developing technology that would allow us to do these kinds of assessments outside of our lab. So, for example, a few years ago, some members of our lab developed something called OpenCap, which is a freely available software platform that can make the same measurements that we were making in the lab for this study, but outside of the lab and really anywhere. And all it uses is 2 iPhone cameras and a laptop. And so, with just that, someone could go out and actually do these assessments in the community or in a clinic, for example. So we're not quite at the point yet where we can deploy that technology, give it to a clinician or a physical therapist, for example, have them do the assessment that we did, and then have them give the gait retraining to that person. But we are making our way towards that, and that's a goal that I think we can hopefully realize in the near future.
Can you tell me more about each of the people that came to your lab that you were studying and what they did in order to retrain their gait, how you worked with them? What was that process like in order to slow the progression of osteoarthritis in their knees?
When we brought a participant in, it was a 1 year long study that they participated in. And so at the very beginning, we bring them in, they get kind of a baseline familiarization with our motion capture lab and with our treadmill that we used. People were walking on our treadmill, and that's where they were getting their gait retraining. And so what happens in that visit is they come in and we measure the way they walk naturally. And then we also have them try a range of different gait modifications. So that's the toe in and toe out that I mentioned. And we, after having them try those different modifications, we then look at our data to see which one was most beneficial for them, and that becomes their personalized gait modification. And then over the course of 6 weeks, they come back into our lab once a week, and they get training to walk at that personalized foot angle. And the way that happens is we have these little buzzers that were placed on their leg, and if they deviated from their target foot angle, they got a little buzz. So it's a little vibrational biofeedback that we would use, and that would tell them like, "Oop, I need to scoot my toes in more or scoot them out more," whichever personalized modification they had. And so over the course of 6 weeks, they're coming in and we're training them to the point where at the end of those 6 weeks, hopefully it's become natural to them. It's become comfortable and just a way that they would walk outside the lab. And so then we have them come back every 3 months for the rest of that 1 year, and we kind of do a check to see how they're doing with that walking pattern. We give them some feedback if they kind of need a reminder of how to walk with that personalized modification. And we encourage them while they're outside of our lab and at home to continue to practice that new walking pattern, and to make sure they're getting out and hopefully doing it at least like 20 minutes a day. And then at the end of 1 year, we then do a final assessment. We get another MRI scan of their knees and ask them to kind of assess their pain. And so really the difference from baseline to 1 year was what we were really looking at with this study. Which the MRI scans were really great because it's a very objective clinical measure of cartilage health that we were able to get. So sometimes having people self-assess pain is tricky because it's a subjective measure. We did see a significant reduction in pain, but what was really exciting was we were also seeing from the MRI scans an objective improvement in the cartilage health for those participants, which was really exciting.
How did you decide to study this?
Yeah, so growing up, I always loved math and science, and I was really fascinated with, biology and medicine. And at one time, when I was younger, I kind of assumed maybe I would become a medical doctor or some kind of clinician. But as I got a little bit older, I kind of realized that being a medical doctor maybe wasn't the area for me, but I still was just really fascinated by medicine and the body. So when I got to college, I actually had no idea what I wanted to do when I first started. And so part of being an undecided major was you had to go to a bunch of different talks and presentations by the different schools and departments. And so I went to, one by the biology department, and I think I even went to the math department presentation. But it wasn't until I saw a talk by the mechanical engineering department, actually, that I realized right away, like, ooh, that's really cool. And the reason I was drawn to it is because it's a very broad field. And one of the things they mentioned was like, you can apply this engineering to the medical field. And I said, bingo. So as I got a little bit older, I joined a research lab that was focusing specifically on a field called biomechanics, which literally is just kind of applying engineering principles to the study of the human body. The human body is amazingly complex. So it was really a perfect combination of my interests in, math and science and kind of the engineering side of things, but also applying that to the medical field and how to help people and, improve life and function for as many people as I could.
Thank you for sharing that. That is really interesting, and I think it's helpful for people to see kind of how those connections are made and how how you get inspired. So I found out about this study because of a news release from University of Utah.
Mhm.
I found it really interesting because Newswise distributes the research news from institutions and research institutions to journalists. And so I saw it, and it had gotten a lot of attention on Newswise. And so it was really interesting, and they connected me to you. So they were great.
Yeah, it's been exciting to see the traction that this study has gotten, and yeah, we're excited because we hope that it's really kind of laying the foundation for a future, hopefully not too distant future, where we can make these assessments not inside of a lab with high tech equipment, but outside of the lab in the community, in a clinic, and be able to do these assessments and tell a patient if a specific gait modification is expected to help them. And hopefully that's something that we'll be able to realize.
Yes. So what's next for you?
Yeah, so our lab really has started focusing a lot on, like I said, really taking these movement assessments outside of our lab space and making them accessible to more and more people. So this particular study focused on knee osteoarthritis, but our lab and our larger group that we work with here at Stanford is called the WUSI Human Performance Alliance, and it's not even just Stanford; it's a collaboration between multiple universities. And so we're really interested in how we can improve movement and function for all people across their whole life. And one area that I'm specifically focusing in now is ACL injuries in young female athletes. That also is a really common problem. A lot of young female athletes experience ACL tears, especially if they participate in sports like soccer and basketball and volleyball. So we're planning to hopefully launch a really large study where we take open cap so that human movement assessment with just the iPhone videos out to soccer tournaments and sporting facilities and schools and develop a tool where we can assess an athlete's risk of injury by looking at their movement to eventually integrate injury prevention programs and hopefully reduce their risk for ACL injuries. So that's a big new area that we're really launching into now with that technology.
That's really interesting because, yes, it seems like the ACL, it's not necessarily an impact injury. It's just like a wrong footing almost or something, right? And so it seems kind of mysterious.
Yeah, absolutely. Most ACL injuries are what's called non-contact, which means they happen because the athlete wasn't hit by someone else, but because they experience a weird landing or they cut and twist their leg in the wrong way. Yeah, and it's an area that is well studied, but an area where we still don't really have a great screening tool, something that's easily accessible to a lot of people, and really a good way of preventing these injuries for a lot of these young athletes.
It seems like it's happening more. Of course, maybe there's more women and girls playing sports. That maybe there's
Mhm.
also more sports that each of them is playing, and so it's also putting
Mhm.
more stress and load kind of on the knee. It's really interesting.
Yeah.
I look forward to hearing about that.
Yeah, we're really excited to see where it goes, and I think you're right. I think it's probably a combination of more and more girls are participating in sport. Also, I think that a lot of young athletes are starting to play sooner and specialize sooner and at younger ages maybe than in the past. So yeah, it's definitely a field that's wide open for these new discoveries, and hopefully we can figure out some good tools that can be used by a lot of people to help that area.
Thank you so much for talking to me today. I really appreciate it, and it's really interesting.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.